The One Big Beautiful Bill turned out to be a great win for healthcare freedom because it expanded access to tax-free health savings accounts, to direct primary care, which gives you more access to your favorite doctors, and to telehealth. And people need to know that those good things are in the One Big Beautiful Bill, and we're going to keep fighting to make healthcare even better, even more affordable. Our goal with our personal option campaign is hassle-free healthcare you can afford. The One Big Beautiful Bill is a big step in the right direction, and we're going to keep moving.
Americans are capable of achieving extraordinary things when they have the freedom and opportunity to do so. This is American Potential.
Hey everyone, welcome to the American Potential Podcast. I'm your host, David Fromm. Today, we welcome back Dean Clancy, Americans for Prosperity's Senior Health Policy Fellow, to discuss the latest developments with regard to health savings accounts and update us on the healthcare aspects of the One Big Beautiful Bill that passed this summer. Dean, welcome.
It's good to be here.
Good. Dean, we always appreciate your deep knowledge and insight. So I'm excited. You know, we've all heard about the One Big Beautiful Bill. We're very excited about it. We've celebrated it here on this show in the lead up to its passage and then its passage. But I'm excited for you to help us understand what's actually in it and all the good things that I think a lot of our listeners can be excited to take advantage of. So let's get into it. So, Dean, every month, most of us, kind of sit down with our household budget, making sure we're spending our money wisely. I mean, at the grocery store, we pay attention to prices and make choices that fit our budget. So shouldn't we be able to do the same thing when it comes to our healthcare?
Absolutely. That's the whole point of our personal option health reform campaign, is we want you to have hassle-free health care you can afford that's as easy as and convenient as, shopping on Amazon or anything else you do in your life where there's just no hassle and you can afford it. And right now, that's not true in American healthcare. That's what we're trying to fix.
So one of the vehicles that is in the One Big Beautiful Bill, our expansion of health savings accounts. I know that we're really excited about that. Maybe can you just give people background? I mean, I have an HSA and I love it. And I'm sure hopefully a lot of listeners do too, but maybe give folks a background on what HSAs are and then some of the exciting changes that have been passed.
Yeah, health savings accounts are a wonderful tool that have existed for a little over 20 years now. They were created by Congress to help people afford health care and take more control over their health care. How they work is, it's like a bank account, although you could invest the money if you want. It's tax-free. The money going into your account, which could be, contributed by you or by your employer, for example, or by a loved one, that money is tax-free. It's exempt from income and payroll tax. The money building up in the account, that's like a checking account or an investment account, that the interest that you're earning, tax-free. And then when you spend the money, you have to spend it on legitimate healthcare services, but you can pretty much, that's anything, over-the-counter medicines, prescription drugs, eyeglasses, MRI scans, you name it, doctor's appointments, all of that, tax-free. It's the only account like this in the U.S. tax code where as long as you're saving and paying for health care, because that's what the account is for, it's all tax-free beginning to end. And as a result, it creates an extremely powerful tool. It's like giving you a discount on every purchase, roughly 25% discount on every purchase. That's more money in your pocket. And as I say, it gives you more control. You choose which doctors you use the account for. You choose what items to buy with your HSA account. Unfortunately, only about 10 to 20% of Americans actually have access to a health savings account. That's a problem we're trying to solve at Americans for Prosperity. Yeah.
I guess I didn't realize that. I mean, why is it so limited? I'm in a sheltered spot, I guess, because being an employee of America's Prosperity, I've been taking advantage of a HSA for, I think, like a decade. And it's been great, and gives us a lot of flexibility. Psychologically, it's wonderful because all of a sudden you're like, you almost feel like you are spending less money because you're not being taxed on it. But it's psychologically, you're like, hey, I have this money set aside for my family's healthcare needs. And it's been great. But I'm a little surprised to hear how low that uptake number is, or that offering number.
Yeah, no, I'm glad you asked, because most people don't realize that HSAs are not unpopular. The reason only about 10 to 20% of Americans have one is because of government rules. I suspect that if, as we want, everyone had access to an HSA, you would see very high take up, because it is an extremely popular tool. And the reason that it has, only got, 10 to 20 million, 10 to 20%, is because you have to have a particular kind of health insurance to be eligible to have an HSA. Now, lucky folks like you and me who work for a great company like Americans for Prosperity, it's common for us to be offered an HSA qualified health plan, so we can have an HSA if we want one. But most Americans are not so fortunate. And what makes the insurance hard to get is that you have to have a certain deductible. That's the amount you pay before your insurance kicks in. It's prescribed by law. Congress kind of came up with some numbers, put them in there. Most people's health plans don't meet the requirement. Medicare, Medicaid, the Affordable Care Act subsidies, and many other government health insurance programs do not meet the definition of HSA qualified coverage. So as a result, most people have no access to this powerful financial tool. And that's why, as part of our personal option campaign, we want HSAs for all. We want to remove those barriers so every American can save and pay for for health care tax-free.
My understanding is that under the One Big Beautiful Bill, in 2026, there's going to be an expansion of HSAs and what they can be used for. Can you share this exciting news with us?
Yeah, it is very exciting. It's a big win for AFP and for the movement to make healthcare more accessible and affordable. Basically, what the bill did, this is the bill that President Trump signed into law on July 4th of this year. It expanded access to HSAs considerably, although not as much as we want by any means, but it was a great first step. It did it in three ways. First, it said, if you buy health insurance that qualifies as what the law calls a bronze plan, which is basically a plan in which the insurance covers about 50% of your costs, and you are on the hook for about 50% of the costs. That's the way they grade these insurance plans. The higher the metal tier, like gold or platinum or whatever, the more generous the insurance is. But if you've got at least a bronze plan, or it could be less generous than that, that by definition, HSA qualified. And that's going to increase the number of Americans who have access by at least 7 million Americans. There's probably about 35 million Americans today who have HSA accounts. And this will increase that to more than 40 million. Of course, we want to get up to, all 350 million Americans eventually. So it's a small step, but so what's the next step on that? Well, let's add silver plans, which is the next step up of insurance generosity, gold plans, and so on. And then more and more Americans will be able to find a plan that qualifies for an HSA. That's the first big expansion. And it's very exciting. We've been working for it for years. And the second big expansion is also really important. It improves how you can use your health savings account. It allows you to pay your monthly subscription to a direct primary care practice.
We call that
DPC. Yeah. Direct primary care, it is exciting. Yeah. Direct primary care is where you pay a monthly fee to the doctors of your choice, your favorite doctors, and they're on call for you. So you can, call them anytime, email them. Telehealth, it's always, telehealth is standard with direct primary care. And basically they're on call round the clock to answer your questions, to help you. And doctors love it because they get to spend more time with their patients, less time filling out insurance paperwork, because DPC doctors typically don't take insurance. They just take this monthly subscription amount. And it's very affordable. It can be like somewhere between $75 and $150 a month for a family. And for that, you get this peace of mind that you've got access to a doctor you trust, and you're not going to be turned down by an insurance company. There's not going to be paperwork and hurdles to get whatever it is you need covered. Now, this is just primary care, which is basic, your usual doctor appointments and so on. Anyway, HSAs now you can use your HSA money to pay for that. That was illegal before the one big bill. Wow. There's probably 75 million Americans who are going to benefit potentially right off the bat. And because we have that many people who are technically benefiting from HSAs today. And as the number of HSAs grows, the number of people who can use it for direct primary care will grow as well. We actually think that in some ways is the most fundamental change in the whole bill, because it's helping people rely less on insurance, third parties meddling in your business, more on yourself, more on your own savings, your own choices. When that happens, prices tend to come down because people ask, well, how much is this going to cost, doctor? And, they shop around, the comparison shop. That was one of the original ideas behind the HSA, was encourage people to shop for value, which had kind of fallen away because everybody tends to rely on insurance. So that was the second big change in the one big beautiful bill. I'm kind of droning on here. I hope
let me I'm really excited about the direct primary care provision, because I frankly didn't realize that HSA money couldn't be used for that. So that's a huge change. We've been fortunate to have a few doctors and practitioners who are involved in direct primary care on the show, and actually just had a dental practice on that's doing that, kind of forging some new ground in the dental area just a few weeks ago. And that's really exciting, because I there's so much promise there. And there's so much, I think you're so right about, right now we don't really shop for medicine. We just kind of take it. Right. And whatever the insurance company or the provider says it is, we're pretty much half the time we don't even, you get the explanation of benefits, you open it up, you're like, oh, that's how much that costs. It doesn't mean much to you. But I think with the direct primary care situation, you're really connected to the costs. And because of that, the providers want to be responsible in how they price things. And hopefully we're not wasting everybody's money. And I do feel like one thing that I took away from the doctors who talk about it is like they really feel like they're getting back to practicing medicine, that they really are doing what they got into medicine to do and feel really good about it. And I got to think that's only going to have better and better outcomes also for people.
Absolutely. And, studies show that direct primary care patients tend to be healthier and have better health outcomes, use the emergency room less than patients in a traditional insurance-based environment. People do enjoy it. They get more time with their doctor. They get to know their doctor better, and their doctor gets to know them better. And that leads to better health care. It's really the way health care should be. And, right now with insurance-based medicine, you go to the doctor. In fact, I just went to one this morning myself. And, they try to move you out of the office as quickly as possible because they've got to basically meet quotas. The insurance companies pressuring them to not spend too much time per patient. So it's like a conveyor belt. But with DPC, it's different. You get lots of time with your doctor. And as I said, lots of access. In fact, I ask people, does your personal doctor give you his personal cell phone number? DPC doctors do. Yep. They want to be available to you. That's what you've hired them to do. And so it really is a wonderful development. It's, most people don't know about it. They've heard a lot maybe about the one big beautiful bill that it averted a huge tax increase that was going to happen at the beginning of 2026. That won't happen now, thanks to the bill. It, did border security and improvements on immigration and tax relief and for working families in a number of areas. Really a great package. Most people haven't heard about the exciting healthcare reforms, including the DPC.
That's great. Well, what other parts of the one big beautiful bill are you excited about?
Well, there was a third item. I mentioned the expansion of HSAs for if you have a bronze plan, and I mentioned you can use your HSA for DPC. The third item is you can use your HSA for telehealth without having to apply it to your deductible. As I said, deductible is how much you have to pay out of pocket before your insurance kicks in. The effect of that is it's like the telehealth is free to you, the patient, at the point of service, and you can use your HSA dollars for any share that, if it's not totally free, if there's a copay or something, you can use your HSA dollars for that. The insurers can provide that, And it's just going to mean that this movement towards relying more on telehealth will tend to expand. It's probably the third most important of those three wins, but it's still exciting. And it's another thing that we've been pushing for. We've got a whole agenda we're still pushing for on healthcare, but those three things are big.
So that telehealth provision, it seems to me that the more people are taking advantage of talking to their doctor and being, seeking feedback or being seen by providers, that they're going to be healthier. And is that just kind of lowering barriers and obstacles so that people are actually engaging with their doctors so that they're healthier?
Absolutely. In fact, we did some research on this a couple of years ago. The AFP and the Progressive Policy Institute, we got together and we studied Medicare data, and we found that telehealth saves money and it saves lives, because when you have access to telehealth, you tend to go to the emergency room less often, which is the most expensive kind of healthcare. And also there's a lot of, infections that you can pick up when you're in the hospital. It means you're not going to your doctor's office, where you could also potentially pick up an infection. And it means that, you potentially can visit more often. But it saves money because typically a telehealth visit costs less than going, to a physical location. So the result is telehealth does improve health. And besides, this is the 21st century. Why shouldn't we be able to do these transactions virtually when necessary? And by the way, telehealth isn't just like a video call. It can be monitoring your vital signs remotely, so that the doctor gets a ping if there's your heart skips a beat, or if your blood sugar, if something's going wrong. So now your doctor, in a sense, electronically is right there next to you all the time, just making sure everything is good. And that's part of telehealth as well.
Well, I remember during COVID, I don't like to remember much during the lockdown, but I remember during that, my daughter needed to travel to Hawaii, and they had some pretty egregious standards for testing. And we did a test that, used my phone, took a sample, and it right there gave you your results, bouncing it back to whatever network they were using, whatever the provider was. It was amazing. I was pretty impressed that, we just did a COVID test. And now, of course, that advanced, but this was a more advanced one than just the swab that we were doing. And it was, it was pretty incredible. And I was like, wow, there's a lot of prospects for this going forward. I mean, with the advancement in technology, obviously in our phones and other things, and then a willingness to do this, that I think there's so many things. I mean, monitoring people, helping people monitor their own health, I guess I should say, on a consistent basis is going to be one of the best preventative things. And that's probably one of the best things we could be doing to keep people healthier.
Absolutely. People are interested. They want to know. They've got these Fitbits and smartwatches now that, they track your blood oxygen and so on. And it's safe, FDA approved technology. And yet, under current law, you really cannot use your health savings account to pay for the device or the subscriptions. And we want to change that too. We want everybody who wants to have a smartwatch or you can have an EKG monitor basically in your pocket, connected to your phone. People should be able to do that with an HSA, and it will lead to better health. It's wonderful. There's so much potential here. Why telehealth has been such a big debate in Washington? It's because the current rules in the Medicare program, and whatever Medicare does, the other private insurers tend to mimic. It said, well, to do telehealth, you have to go to a location. It can't be from your home. It has to be from you drive to someplace to do a telehealth call, and the doctor has to go someplace. And then it has to be two-way audio and video. Can't just be, audio only. And all these requirements, and it can only be certain kinds of medical providers. It can't be, a chiropractor or something. I don't know why you'd do a telehealth with a chiropractor, except maybe just to report on the pain in your back or something. But point is, these are crazy government rules that need to be removed, and that's what we're working on.
So there are a few things that I know that we wish were included in the One Big Beautiful Bill. So I imagine we're going to keep pursuing those for the future. So what are some of those exciting, hopeful developments?
Well, we want everyone to have access to a health savings account. And this Congress, which passed the one big bill, will probably consider additional health-related legislation within, 2025 or 2026. We don't know the exact procedure they'll follow. We don't know how much we'll be able to accomplish, but leaders of Congress are generally on board with doing more. They wish they could have done more in this big bill, but they had to get the votes and get it through the process. And so we want everyone to have a health savings account. We would love for direct primary care to be available, not just for primary care doctors, but also for specialists, and also imaging, like radiologists and stuff. Right now they're not classified as primary care, so we don't get the benefit of this recent expansion on DPC. So, and we want to reform the big government healthcare programs. By the way, the one big bill did institute some very sensible reforms of Medicaid and the Affordable Care Act, Obamacare. Basic things like making sure that people are really eligible for benefits, that they're not receiving duplicative benefits. There's a huge problem of that right now in those government programs where there's a lot of waste, inefficiency, so people are on the rolls who shouldn't be. And the one big bill contains some real sensible reforms to deal with that. They're going to save like almost $1 trillion over 10 years, and nobody is going to lose access to health care who's truly needy, who should really be on the program. Unfortunately, Democrats and progressives have been attacking those Medicaid reforms, but honestly, it's common sense stuff. We want to do more like that throughout government programs so that they are a true safety net. They really make sure no one falls through the cracks. We save taxpayer money. We don't waste money. But at the end of the day, everybody who needs health care gets the health care they need when they need it at a price they can afford.
I kind of want to go back, kind of hover over a little bit what you were saying about Medicaid. And there has been a lot of misconceptions put out there, I'd say, by opponents of this bill, on the left especially, trying to scare people, I think, about some of the reforms. To me, they seem very commonsensical and also have the goal of strengthening, what I think a lot of us agree should be a healthcare safety net for folks who can't afford it or are in need. But unfortunately, there's an incredible waste and abuse. Can you kind of go a little deeper on like what this does and how you think it is going to make a difference?
Absolutely. The one big bill, for example, gives states more tools to make sure people are actually qualified to be on Medicaid. It says and it also requires them to check for that more frequently. Right now, they're required to check eligibility. What's your income? Because Medicaid your eligibility is based on income. Right now, you're supposed to check that once a year. And the bill says, let's check it every 6 months. And this is a little bit of a burden on states, but it's valuable and it will save money for both the states and the federal taxpayer ultimately, because you'll have less of the problem we have right now where, for example, the Medicaid agency, the federal Medicaid agency, CMS, found out recently that 2.8 million Americans are enrolled in Medicaid in more than one state.
Wow, almost 3 million Americans. That's phenomenal.
Almost 3 million Americans. They're in more than one state. I mean, you only live in one state at a time. I understand you might work in one state and then cross the border to for your home, but you wouldn't be in Medicaid in both states. And why is it wasteful? Because when you're on Medicaid, typically what the state does is they send a check every month to a health insurance company, an HMO, to provide health insurance for you. So if you're on the rolls in two states, a health insurance company in two different states is getting a check every month on your behalf, even though you're legally only entitled to be on the rolls in one state. That's just one example. And but you're asking about what the bill does. Other things. It does ask people to work for their benefits if they're able-bodied. This has never been the rule in Medicaid before, where you were asked to actually meet a work requirement. So that, it's to try to prevent the problem of people just sitting on their couch having a Medicaid benefit, but not, and they're able to work. They, have to be able-bodied, but they just don't do it. And this is a rule that you find in other welfare programs, and it is now going to be the rule for able-bodied people in the Medicaid program. Very popular reform. It's not something that we pushed for hard. We're more focused on the sort of the things like, ensuring that people are eligible, but it's very popular, and that will make a big difference. And also, non-citizens. The bill does basically have, tougher checks to make sure that people who are legally eligible, based on their citizenship status, that they're only the people who are eligible are on the rolls. Those are a few examples.
That's great. Yeah, I think that, like I said, there's been a lot of misinformation out there, and every time I delve into these, they're really commonsensical and make a lot of sense. So finally, something that doesn't make sense. My understanding is that the Biden COVID credits are set to expire. What's the story with those?
Well, the Biden COVID credit, I'm glad you asked about this. I was hoping we'd talk about it. Biden COVID credits are expansions of Obamacare federal subsidies that were enacted under the Biden administration during the pandemic. Basically, it was the real motive was to just make Obamacare much more attractive to people, so more people would sign up. They used the pandemic as an excuse to do that. They said it's a pandemic measure. We need to just absolutely beef up this program. And it was temporary. By the way, the expansions were very generous and very expensive. They basically lifted the income cap, so which means, you could make $500,000 a year and get a little bit of a subsidy for your health insurance through Obamacare because they removed the income cap. They made it kind of universal. They also made the benefits more generous. These subsidies basically go straight to a health insurance company on your behalf. So you go on to a website, healthcare.gov, or your state's online marketplace. You pick a health plan, and it tells you how much your part of the premium is going to be, and it gives you a big federal subsidy, assuming you meet the income requirement. Although, as I say, under this temporary Biden policy, there is no income requirement, except the amount of the subsidy does phase down a little bit. But for people below 150% of poverty, insurance became absolutely free. That was never the case with Obamacare before the Biden COVID credits. Everybody had to put a little something in, have a little skin in the game. And so because of all those changes, the number of people signing up for Obamacare doubled in 2 years. And a lot of people are on the rolls now, don't even realize they're on the rolls. They've forgotten, or some insurance broker signed them up because basically it's a free commission for the insurance salesman. And a lot of fraud, a lot of people whose income is not below 150% of poverty, but they just report it that way, and there's no validation, no checks on that. We think there's probably 6 million people on there who are not entitled. In fact, I think it's 15 states, more people are signed up for free health insurance through Obamacare than are in that income category in the state. There are more people signed up than are actually eligible. And the Paragon Health Institute is a think tank that has been doing a lot of research on this. They've uncovered these problems. So you started with the question, what happens with Biden's COVID credits? Well, they expire at the end of 2025. They were supposed to be temporary. It was supposed to be for the pandemic. Now they're going to go away. Well, guess what? Unfortunately, our friends on the left and the progressives are adamant. And also the health insurance industry and the hospital lobby, they've all become adamant that these be made permanent because it's more money for them and it's more government. And it'll cost taxpayers about $400 billion with a B over 10 years to keep these Biden COVID credits going. And our view is the pandemic is over. These credits have led to all kinds of fraud and waste. They need to expire on January 1, 2026 as scheduled. Will people be hurt by that? No. The charge is, oh my gosh, people's premiums are going to go up. Well, technically nobody's premium's going up, but their federal subsidy may go down a bit. But we're talking about a change for a lot of people that will be on the order of going from, $1 a month for a premium to $30 a month. I'm just picking a number, but it's in that kind of range. It's not like people are going to be devastated. And of course, some of those wealthier people, more affluent people, they might, in fact, have no subsidy anymore. They can still sign up for the insurance. They'll just have to pay, full boat on that.
Sure.
But then they're more affluent. So I've gone on and on this. But the point is, we really would like to see these expanded credits go away. It's good for taxpayers. It's good for healthcare. And that's what we're working on right now.
That's great, Dean. Well, there's a lot of exciting stuff going on, more to come, which is really exciting. But maybe just as a final wrap up for us, I mean, just maybe sum up what made you excited about what happened this past summer with the One Big Beautiful Bill, and your outlook on where we're going with this administration, this Congress.
The One Big Beautiful Bill turned out to be a great win for healthcare freedom because it expanded access to tax-free health savings accounts, to direct primary care, which gives you more access to your favorite doctors, and to telehealth. And people need to know that those good things are in the One Big Beautiful Bill. And we're going to keep fighting to make healthcare even better, even more affordable. Our goal with our personal option campaign is hassle-free healthcare you can afford. The One Big Beautiful Bill is a big step in the right direction, and we're going to keep moving.
That's great. Well, Dean, I always appreciate you as an absolute healthcare expert, recognized on Capitol Hill as an expert on healthcare. You come on here and help us, some of us who aren't experts, really understand what's been going on and what's coming, and even how we can take advantage of it. So appreciate you coming on again.
Oh, it's my pleasure.
Well, folks, if you like this episode and would like to stay connected with the podcast, be sure to like and subscribe to our channel, as well as following us on Facebook, Instagram, and YouTube. And always remember, liberty and freedom are easily taken for granted. Don't take them for granted. Go out there and defend freedom and liberty. Thanks for joining us, and we'll see you on the next episode.
Thank you for listening to American Potential. You may listen to more stories from Americans working every day to expand freedom and opportunity in their communities by visiting AmericanPotential.com.